Thank you very much, and good afternoon to all. We will now reconvene this morning's hearing. Um, this morning, we had the Department of Streets and the Fire Department of Corrections. And on behalf of the Department of Corrections, Mr. McDermott, who we have to testify?
Our next witness is Blanche Carney, Commissioner.
Good afternoon, Commissioner. How are you?
I'm well. Good afternoon, Council President.
Good, good. If you could just state your name for the record, and please proceed with your testimony, and we can get started.
Thank you, Council President. My name is Blanche Carney, Commissioner of the Philadelphia Department of Prisons. And joining me today are Deputy Commissioner Xavier Buford. I'm pleased to provide testimony on Department of Prisons Fiscal Year 2023 operating budget. Our mission of the Philadelphia Department of Prisons is to provide a secure correctional environment to detain accused persons convicted or alleged of illegal acts and to prepare them for reentry into society in a clean, lawful, humane, and safe environment. The PDP offers training, educational services, parenting classes, substance use services, medical services, behavioral health therapy, and counseling, individual and group therapy. To ensure successful reentry and to elevate the city and the PDP's focus on reentry, we continue our partnership with the Office of Reentry Partnerships, which was created by the Managing Director's Office as the umbrella agency to coordinate, maintain, and expand public-private partnerships across the city to ensure linkages to community services post-release and replacing the former RISE office. PDP, working with ORP, will ensure that there is a continuum of reentry services for people incarcerated after PDP. This partnership will play a critical role in the city's efforts to reduce recidivism as criminal justice reform in Philadelphia evolves to focus on community reinvestment and reentry. Plans for fiscal year 2023, the department will continue to support the administration's goal of criminal justice reform and reinvestment in the community by working with the Office of Reentry Partnerships for post-release and pre-release engagement and post-release services to support successful reentry. The Office of Reentry Partnerships serves, again, as the lead for the city. Our reentry efforts were expanded, and most fines and fees, example, commissary processing fee, check processing, and notary fees were eliminated. These fees and fines greatly impacted marginalized incarcerated people in their community, which often provide financial support during incarceration. PDP increases provision of additional free phone time for calls and virtual visits in support of reducing costs for incarcerated individuals and their family and friends. These financial changes align with the administration's efforts to reduce poverty and increase equity for services. PDP experienced an increase in the incarcerated population over the past 2 years of the pandemic. In partnership with the Criminal Justice Partners, First Judicial District, District Attorney's Office, Public Defender's Office, and the Sheriff's Department, we continued our efforts to safely reduce the prison population by consistently modifying our applicable policies to align with CDC guidelines, which allow for incarcerated individuals to be transported to court. As a result, we have recently had a higher number of incarcerated individuals being transported to court. These efforts have been coupled with PDP's continually providing information for targeted populations such as incarcerated individuals who have served their minimum sentence, medically fragile, 60 plus years of age, who are charged or sentenced for nonviolent offenses for release consideration. PDP continues to work with the First Judicial District to make incarcerated individuals available for in-person and virtual hearings. We expect the combined efforts of the criminal justice system will continue to safely reduce the population through case disposition for county and state sentences and releases as determined by the court. Thus, we have begun to see a slow reduction of the population, a decrease in the pretrial population, and an increase in the sentence population as determined by the court. The PDP is a 24-hour-a-day carceral operation, which requires continuous staffing and routine upgrades to modernize infrastructure to its facilities and equipment. And the PDP is experiencing staffing challenges similar to nationwide trends in corrections. PDP will continue its aggressive hiring efforts to fill vacancies and increase retention accordingly. PDP was not exempt from the supply chain issues which delayed the lock replacement project by several months and beyond its control. PDP is pleased to report new locks were received in November 2021 and January 2022, and we commenced both projects. And we are pleased to report that for Riverside Correctional Facility, 384 locks have been replaced and installed. That is the entire facility completed ahead of the June 30th, 2022 schedule. The Philadelphia Industrial Correctional Facility, we completed 576 new locks of the 600 locks, and we have 24 locks to go, well ahead of schedule. Our spending largely stems from policies, professional standards, and operational priorities established by our contracted medical behavioral health, food maintenance contracts, and associated staffing costs for the respective collective bargaining agreements. Our budget supports required services for the incarcerated population and aligns with our operational goals of providing services such as food, medical, behavioral health care, and ensuring the maintenance of our facilities while pursuing the resumption of full operations. Our plan for fiscal year 23 and beyond are broad-based, considered most areas throughout the prison department, and support our primary goals, which include house on average 5,000 incarcerated individuals throughout fiscal year 23, ensuring meals, education, programming, medical services, and as completed. Continue on-site COVID-19 testing and vaccination for staff and incarcerated population. Continue to provide medication-assisted treatment to all opioid-addicted incarcerated individuals. Continue to effectively link all medication-assisted treatment patients to community MAT providers upon release. Continue to provide hepatitis C treatment linkage program. Improve continuity of care by enrolling all eligible incarcerated individuals in medical assistance. Continue our efforts to complete implementation of the federal lowest possible cost 340B pharmacy arrangement. Continue making post-release appointments for chronically ill sentenced individuals with community providers. Continued utilization of Class 100s to fill vacancies and reduce overtime costs. Continue phased reopening to full operations by expansion of in-person civilian visits and programs. And continue to provide correctional staff with professional development and continuing education opportunities. This would allow the PDP to maintain the highest level of professionalism among its correctional staff, supporting current theories and practices while interacting with incarcerated individuals and their personal safety. The proposed funding requests for fiscal year 23 general funding totals $246,068,033, a decrease of $5,334,707 over fiscal year 22 estimated obligation levels. This decrease is primarily due to the reduction of the additional support we receive for COVID-related care for incarcerated persons, inclusive of testing and medical services, PPE, and contraband detection scanners. The reduction was due, we anticipated, based on the infection rate of the COVID-19 pandemic, that we would require the $14 million. However, we continue to mitigate the spread inside of our facilities, and that money has been returned back to the general fund. The proposed budget includes $135,495,470 in Class 100, and that is a 1.6 increase over fiscal year 22. This funding was added to support wage increases, in addition to providing funding for additional correctional officers. $104,697,211 in Class 200, a 6.1 decrease from fiscal year 22. This was for the funding for the COVID response treatment, and we explained that we thought we projected we would need that much funding, but we continue to mitigate COVID-19 inside of our facilities. $4,674,595 in classes 3 and 4. That's an $824,000 decrease from fiscal year 22. The funding had previously been allocated for the purchase of contraband detection scanners and COVID PPE. The justification was submitted for additional funding to expand the contraband detection scanner investment. And $1,201,757 in Class 500 level with fiscal year 22. This funding is provided for inmate work pay compensation. And I am happy to take questions. Council President.
Thank you, Commissioner, and thank you for the work you do. We know we've had a challenging last couple of years, and in your line of business, it's been a challenge for a while, just generally, given what you do. So we want to thank you so much for you and your team and all our COs and all the other support staff, the work they do. You referenced your Class 100, and I see in your budget, you said you get 1.6 million additional for wage increases and additional correction officers. Can you break that down? I mean, how many additional correctional officers can you get as a result of this? Because it doesn't seem like 1.6, there's a lot in the overall scheme of things, but it's not a lot, given
Thank you, Council President. That will get us 180 additional correctional officers added to the complement.
Really? Okay.
Yes.
Okay, cool. So with respect to that issue, the staffing challenges that we have all had, some more than others, you more than most. If we're adding additional dollars for additional staffing, have we solved the problem with staffing up under the existing budget and to fund the current level of positions? I think we have around, like, for security and operations, we have like 1,900. So, I mean, I guess my question is, and if we need more money, that's fine, but why are we adding additional dollars if we can't staff up based on our current budget?
Okay, that's a fair question. So the 180 positions were part of the lawsuit that was added above our current complement. We still must continue to do all that we can to onboard and attract folks back to corrections. In Philadelphia and nationwide, the attrition rate in corrections has skyrocketed over the course of the pandemic. Our classes are much smaller than we had pre-pandemic. When folks were interested in corrections, it still is a viable career, but we have to attract folks back. We are working tirelessly to really sell the benefits of being in corrections as a correctional officer, the employment opportunities, the benefit opportunities, and most importantly, the pension opportunity. But what we're up against, and we'll continue to do our due diligence, is we have to counteract a lot of the negative coverage that we've received. Corrections as part of the law enforcement the community has been impacted, and those folks have assessed and done self-evaluations and moved on, but we still have to engage and on board. What we changed in our strategy was we partnered with PhilaWorks and PA Career Link, and we're doing print ads, we're doing radio ads, we're partnering with our colleges, universities, faith-based communities to get the information out to individuals to attract them back. But it is an uphill challenge, but we're doing all that we can. We currently have 47 cadets in the academy. Our classes are much smaller. Pre-pandemic, we averaged 50 per class, but our response to the position has also seen a decrease. So we're doing all that we can to work with the Office of Human Resources. We have an upcoming job announcement May 16th through the 27th, and we partnered with them to get us a QR code so folks could just click. We're on social media getting those announcements out. But these two small classes, 27 are expected to finish in June, 20 in July. We also have 2 upcoming job fairs, Saturday, May 14th, 9:30 to 3. And that is the Diversity Law Enforcement Career Fair that's sponsored by Commissioner Outlaw of the Police Department. Will join with other law officials. Also, we have Friday, June 17th, 9:30 to 1. That's the 15th annual Neighborhood Job Fair and Resource Village. In both events, I'm going to take the opportunity to get this in, 1816 North 15th Street. But we will continue to do all that we can to increase our staffing numbers.
Okay. All right. I'm still not clear why you need the additional 1.6 if you can't staff up with the existing budget.
The 1.6 are to cover those positions that were in agreement under the litigation.
So it's
So
more than that.
so
All right.
that's what it's
In
for.
spite of the fact that, so you
Yes,
basically don't have a choice. You still have to fund the positions, even though you can't actually put people in those positions.
that is correct.
Sometimes, okay, I'm just, and that's not your fault. I mean, that's court said do it, so you got to fund it. Although we have challenges filling the position. Okay, I got clear. Um, with respect, what's going on with the House of Correction facility?
The House of Corrections is decommissioned. We use the what we call the administrative portion of the building, which is the front, but no population is there. But we are
Okay.
maintaining it.
Okay. And I know last year I asked you, I think I asked you the same question, and I know you were using it for administrative functions. We're still, but you still, there's still a cost associated with maintaining the facility and the entire grounds. Is there a plan to ultimately, um, dispose of the property?
Uh,
Or,
the
I mean, or do we really need it for administrative purposes?
We need it for administrative purposes, but if I could demolish the entire building and erect a new facility, and that would encompass a co-location space, if we were able to do that and receive the approval, it would be to use that footprint that sits in the middle of the campus for a new training academy facility, some co-located housing for youthful offenders who are committed under court order here. And we could also use that for some civilian services and programs for the population.
Okay, is that something that's being discussed, or is that?
It's not currently being discussed. We talked about it. Certainly, we can go back into discussions, but that would be used for that footprint because we're maintaining it just so it doesn't, fall or create any hazards on the campus. But the location would be prime for us to use it for those purposes.
Okay, so even though, we don't have much use at this point, we don't want to get rid of the real estate because there's likely an opportunity or the possibility that we could need that campus at some
Yeah.
time in the near future. All right.
Yes, I see us repurposing that footprint. Yes, I do.
Okay. All right. Well, thank you. Okay, thank you. Thanks, Commissioner. Chair recognizes Councilman Jones.
Thank you, Mr. President. And thank you, Commissioner, for your service. You, under any stretch of the definition, have a difficult job. Public safety in that facility means public safety for the inmates and public safety for the correctional officers that are there. I want to thank members of the Public Safety Committee for being in close communications with your department and for, in particular, Member Gim and Member Brooks for, on several occasions, taking the tour, walking the walk up on State Road to look at the conditions up close and personal. And I want to, before we go into the questions, recognize that yesterday I referenced Spartacus, which is one of the series that I admired. And I said that you, in your position, and Danielle Outlaw in her position, were Spartacus. And one of the responsibilities we have as a municipality is to make sure you have the equipment that you need, the resources you need, money, and the personnel you need to perform your functions. You did a very good job during COVID protecting, keeping safe both the inmates and the staff up at the facilities, better than some of the nursing homes that we had to deal with out in the community. You put a plan in place and it worked. So how close, so let me get to it. How close are we, and this is above your pay grade, are we making progress on the labor contract between the city of Philadelphia and the corrections officers?
Thank you for that question, Councilman Jones. We are amid interest arbitration where active labor negotiations are underway. It is very interactive, and I believe that we will come to a resolution soon. But labor negotiations are underway, and we presented both proposals, and we'll see. And I'm hoping for a fair contract.
That is important because the stressful conditions that some of your employees are under, and what amazed me was those pods were 60 to 80 men in them, and they would be housed by 2 corrections officers. And on a lot of occasions, it was one female at a desk with some plexiglass. And so the way they are able to work to keep control and forced sometimes to work without backup is pretty harrowing. But we don't want to put that out there too much to kind of tip the conditions of what's going on. So you had a series since the young man, I think his name was Harold, Hargrove?
Mr. Hargrove.
That was killed up in the parking lot of the prison, was released at early in the morning, and some deficiencies in equipment were recognized. Talk to me about corrective actions taken since then.
Thank you, Councilperson Jones. So first want to commend the dedicated men and women and staff who report for duty. I have to commend them. They are standing security posts in these facilities that are running 24 hours a day. You're absolutely right. There were, women, 51%. They're coming to work. They're doing what we've asked them to do, what we've hired them to do. In the case of Mr. Hargrove, we had installed, because of the events that took place, we currently we installed readers, license plate readers. We installed additional lighting in those areas. We also changed our release procedures where we still were allowing folks, we cannot detain people under law longer than they're supposed to be after they've been posted bail. But what we've also ramped up and increased is funding for our post-release transportation services that transports individuals off-site at undisclosed locations that are not shared publicly. We've asked the individuals who are being released not to share or post information regarding their release. And we also offer trans passes and SEPTA transfers for those individuals once they are taken to that specific location.
So there was an Uber style or van style release point, taking them to a transit node away from the actual facility.
That is correct. That is available to them. Also, individuals who insist on utilizing SEPTA, we still support them and allow them to do that. We also coordinate if they contact a family member and the family member sends Uber, we allow that Uber. We instruct them where to park so they can pick up the individual and take them off the campus after release.
So let me segue. Those cameras, license plate readers, added to the safety of release, the vans to take them to transit nodes was a corrective action step post Mr. Hargrove's death. There have been other deaths that have been at the facility. We had a meeting with the health providers that are contracted with the prison. And could you separate into the following categories? How many of those deaths were due to some traumatic detox kind of related illness and or death? How many were suicides? And how many were homicides of those deaths?
So in 2020, the total number was 11, of which we had 1 suicide, 2 homicides, and 1 COVID related. In 2021, we had a total of 18 deaths, 3 suicides, and 2 ruled a homicide. In 2022, we had 4 total deaths. What I can share with you, because any case that is still pending the autopsy results or in litigation, I won't be able to disclose any additional information. But what we can say is any death is awful. And even though we report out and we're sharing information, we're restricted by how much we can share. But at the same time, we offer counseling in any situation to the medical staff, security staff, other staff, and incarcerated people who are involved with the decedent, or if they were there. And that it's a painful shock to the prisons. It doesn't get any easier. The medical examiner report shows that 3 incarcerated citizens have died at PDP from COVID, 1 in each 2020, 21, and 22. The count includes people with very serious, life-threatening, pre-existing chronic care conditions. And during this time, over 40,000 people were in and out at some point at the PDP. And our medical consultants, which we are contracted with, of those 3 deaths, reported that none of the 3 deaths were avoidable, but they had some underlying. Regarding withdrawal deaths, we worry that the risk will increase if use of xylazine, which is the trained dope, an animal sedative, continues to increase, and we're seeing that in the city. Unfortunately, xylazine does not respond to Narcan, and the number of withdrawal cases which medical sends to the ER directly from intake is definitely increasing. So we're seeing those folks coming in. We place all incarcerated persons who report use of opiates on the clinical opioid withdrawal scale protocol, which assesses where they are in that withdrawal process. And we include our palliative meds in 3 evaluations by our nursing team.
So my time is up. I want to end with that lock issue, which led to some unrest in the facility. Could you repeat real quick how many locks have been replaced? How many locks still need to be replaced?
So at RCF, all 384 new locks have been installed. At the Philadelphia Industrial Correctional Center, 576 of 600 have been installed. We have 24 remaining locks to be installed at PICC, and that is because some additional work is required to that area where the locking mechanism is.
Thank you, Mr. President. I'll relinquish the mic until round 2.
Thank you, Councilman. Chair recognizes Councilman Thomas.
Good afternoon, Council President. And thank you to our Commissioner, as well as our Chair of our Public Safety Team, Councilmember Jones, who keeps us informed on these issues. I have a couple questions. I think just to continue Councilmember Jones's line of questions around the deaths in the prisons. I'm assuming, Commissioner, you basically don't have any information for us on those deaths?
I can confirm, but I cannot release specifics if they're under they are under litigation or determined to be a homicide.
All 4 of them are still under litigation?
The 4 are still under investigation. And then there's a 2-year period whereby someone can file a notice or an intent. So I can't share much information beyond that.
Yeah, that's disappointing, especially considering the conversations that we've been a part of, as well as some of the issues that the public has around safety and transparency and things of that nature. I think that if all 4 deaths happen, at the same time, that would make sense. But if a death took place in January compared to a death that might have taken place in April, I mean, the amount of time that has passed since January, one would think that we would have some level of information, but I guess that's not the case. So with that being said, one of the things that this council body did to help law enforcement with issues around hiring is that we lift the residential requirement for a brief stint of time. I'm a big fan of the residential requirement. Not just for economic reasons, but for cultural purposes as well, too. So by no means am I recommending that we need to get rid of that stipulation, because I think it's one that's very important. I'm wondering if we did something similar for correctional officers as what we did with police, where we temporarily lifted that the residential restrictions. Do you think that would have an impact on some of the hiring issues that you're facing right now?
Thank you, Councilman Thomas. For the residency waiver, we were approved for that at the same time at the time the police department was. So we anticipate that we'll receive a greater response, hopefully, to applicants. In the last round, where we had 700 plus individuals, there was a significant number of folks that we just were not able to engage because of the residency requirement. And
I'm sorry. Well, from a numbers perspective, like how much do you anticipate being able to address the hiring issue? Like what percentage do you think of those open vacant positions that we can fill with that being in place now?
I can't give you a definitive response, but if I had to give you an estimation, we're hoping that we could get to at least 30%.
Okay, so you should be so that would get you, based on that timeline, how long would it take you to be fully staffed to where you need to be so that you have all the tools that you need?
So now that we are approved for continuous hiring, if we continue to see an increase in the onboarding of classes, we are looking at, and this is a conservative, you're looking at September.
Of this calendar year?
Of this calendar year, if we see an increase in the number of eligible candidates being onboarded, and then us having the ability, we have changed how we onboard. We used to have 4 cadet classes per year. We're doing continuous hiring, and so we have multiple classes in the training academy.
So what are we doing around retention bonuses and things like that for officers?
We are currently in arbitration and discussion talks, and we'll wait to see what that award will give the workforce for, first of all, to attract and retain current workforce. So I'm looking forward to seeing what the award will give us.
I am as well. What about the independent monitor that was brought on board? Was that something that was extremely costly to your budget? Because I like Council President here that you're asking for a budget increase, which, again, logically, I don't understand it. Like, why would we give more money if you haven't been able to spend the money that we gave you already? So I'm looking at, the staffing issues and asking about a budget increase, but also money that's been spent, specifically looking at the independent monitor. How did that, what does that contract look like? And how have we benefited from that hiring?
Well, the litigation from the federal court told us you will hire 180 additional correctional officers, and there will be a monitor appointed. So that was not something that I could justify yes or no. We accepted that direction, and that's what we will do to remain compliant. Are you speaking about Mr. John Wetzel?
Mute again. I apologize. I'm not speaking about a person specifically. I know that this was something that was mandated, and that's why I wanted to ask, how was it going and the impact that it's having on some of the issues that we're trying to address?
So I believe that even though we didn't ask for those positions, I think it is imperative that we take advantage of that order to hire as many individuals as we can. We know that there are individuals in the drop. We know that there are individuals who will transfer, that we anticipate may transfer or separate. So it is in our best interest to fill as many positions as we possibly can. I'd like to thank Councilman Jones, who has been a staunch supporter in that anytime we are announcing the job and it being open, that he's posting that information, he's sharing that with his constituents to increase that. And I would hope and welcome all of City Council doing that, because I think your voice is important. You're in touch with your constituents, and this is a good job. I think we have to balance it against the negative coverage, right? And if they're hearing it from you, we're doing all we can. But if they're hearing it from the council members at large, I think that'll get us in a much better position.
So I have a social media page that's dedicated to posting jobs and resources and opportunities and things of that capacity. Once information is sent to my office, we always share. We have no problem with that. So once the chair of public safety or the council president or even you directly send that over to us, we will be more than willing to share. But I do want to just state as my time wraps up that we can share about the jobs. We can do everything in our power, residential stuff to encourage people to apply for those jobs. But I think that there's always going to be a lack of uncertainty when we have issues like the 4 deaths that took place this year, and there's no communication with anybody as it relates to how those folks died, what's going on with those investigations. It creates, when I was a teacher, and I'll stop at this. When I was a teacher, one of the things I used to tell the kids all the time is, you're not supposed to be talking in class, of course, but when you whisper, it make me want to listen even more. Us not talking about what's going on and us not telling people what's going on, it only makes everybody more suspicious. The narratives begin to grow, the rumors and the false information begin to spread, and they take on a life of its own. So I think if we're really trying to address some of these issues, a part of the solution is transparency. Thank you, Council President.
Thank you, Councilman.
Council President, if I may, and I sent this information, as Councilman Jones stated, to members of the public safety. We can't release all the information, but as I'm hearing Council Member Thomas's comments, what I can say is that incarcerated person, 34-year-old white female, January 23rd, 2022, was a new admission pending investigation. Incarcerated person, 64-year-old Hispanic male, January 26, 2012. He was hospitalized with underlying medical complications since January 12, 2022, under investigation. So he had underlying health conditions. Incarcerated person, 38-year-old black male, February 8, 2022, had been in custody since January 31, 2022, was found unresponsive in his cell. There was no evidence of violence, under investigation. Incarcerated person, 55-year-old male, March 8, 2022. He was admitted March 7, 2022, and he was in the receiving room. And that's the extent that I could share. We can give you that much information, but we won't be able to expound upon. And one of the things I think that you raised and we talked about were the number of people that are dying at the time of intake. And one of the things is that we're seeing these are the same people who are suffering and dealing with substance use, that are coming into our custody, that are taking whatever quantities they have prior to setting foot in our door. And then by the time, coupled with those underlying health conditions, we're doing all we can to do that assessment at the point of intake and properly assess and get as much information as we can from these individuals to make sure we're assessing and treating and getting them where they need to be, so there is no loss of life. But it is concerning for us, but we have that short window trying to glean as much information. But these are the same people in our community that are actively using, and that's why we're concerned about the xylazine and trying to engage folks in the time where they don't want to answer any questions, but we're trying to garner as much information.
Council President, I just want to say thank you to the Commissioner. I think that type of transparency is extremely important. The information that she just gave us, I think it's not just vital to us doing our job, but vital to the public as well as those that we are trying to court into the position. So, Commissioner, thank you for that information that you just provided. I think it softens the blow a little bit. Clearly, there's still more information to be found, but I think that makes me feel way better than what I did prior to the start of this hearing. Thank you, Council President, and thank you, Commissioner, and to our Public Safety Chair, who's been on these issues from the very beginning. Thank you, Councilmember Jones.
Thank you, Councilman. Before I call on Councilman Dom, I just wanted one quick question, Commissioner. You referenced 700 applicants, and you weren't able to access all of those people because of residency issues. What do you know the breakdown, the percentage of non-residents versus residents?
We can go back to the list and get that information. So the lion's share either signed up, just didn't report for orientation, weren't eligible. And then there was a small population, about say
No,
about,
I'm just asking about residency versus non-resident.
yeah, I would say about 7%. 7%.
So the
Yes,
overwhelming majority of the 700 were residents.
yes.
All right, I just got to clarify that because, and I know people say, why does Daryl keep on harping about this residency issue? And the bottom line is that this council and the city said we were going to deal with poverty in the city of Philadelphia, all right, and very aggressively. And the bottom line is the city's biggest asset of getting people out of poverty is to give them a good city job. So that's one of the reasons why I focus on this issue around residency and giving that person that lives in the city of Philadelphia, as you said, a good job. So, but I just wanted, when you said it, well, I couldn't access a lot of people because of the residency issue, and it kind of came off to me, and maybe I'm a little sensitive to that as well. If I was able to access it, and that I would make it would be much easier, but 7% is not a lot of people. All right, so you personally, okay, I'm cool. I'm sorry to butt in like that, but this whole residency thing really it really irks me because the narrative is just not accurate. Sorry about that. Sorry for jumping in with that. Thank you, Commissioner. Chair recognizes Councilman Dom.
Thank you, Council President. Good afternoon, Commissioner.
Good afternoon.
Thank you to you and your team for everything you're doing. I know this is not easy, what you do. It's one of the more challenging jobs in our city. I have a couple of quick questions. Are we aware right now, can you share with me, the recidivism rate right now over the last year or two or three for the prisons on State Road?
Yes. If you could give me a couple minutes, I do have that.
Okay. And by the way, Councilmember Jones, thank you for all you're doing in this area. Really appreciate it. Doing a great job. Thank you.
DC Bagby, do you have that at your fingertips?
You can come back to me with that answer while we're talking.
Okay.
So the reason why I'm asking the question is because I want to also ask you at the present time, what are the courses we're offering returning citizens in order to get them equipped to enter our economy in the city? And I know before the pandemic, I had sponsored a few financial literacy courses. I think I sponsored a coding course. And with your permission, I'd like to start doing that again because I think it's a real plus for people coming back into the city, especially from State Road. So what are the courses we've been offering over the last 6-12 months there?
So we've been offering, and this is, we had to pivot to virtual. So we just had our first graduation of Reclaim You. That is a PA certified program where we did this program, the first pilot with the female population, where they become certified home health aides. So they take the certification, they pass. Once they leave out, they link up with this organization, Reclaim You, and they're placed in jobs. So we're giving them certification, and that's where we're moving towards. Not just a certificate, we're looking for certification that will get people into sustainable wages. So it's not just a 3-month program, you get a stipend, and then after that, we wish you well, and you're right back into survival mode. Then the long-standing program we have, and it continues to date, is the New Leash on Life program. That is an intensive K-9 training program where we have individuals that are paired up, and again, they are certified in K-9 training, and then they go into real life job opportunities that are sustainable long term. Some of our graduates have graduated to supervisors, and they are doing very well. If they go to the program and that opportunity isn't working out, then they place them in another job opportunity. Then with our Inside Out, we have Arcadia University and Gwinnett Mercy. We were doing virtual programs with them, and we're still involved with the Temple Inside Out program. We really pushed and we established and came to an agreement where the incarcerated students, they can earn up to 4 credits. Those 4 credits, they can transition and test in. So that's where we're going right now. We're not at full operation, but I'm looking for more opportunities, Councilman Dom, that you funded before for us to be able to do that.
And let me say this, Commissioner, I'm happy to fund them again. And I did speak with the library when they were in our budget hearings, and they're prepared to come back. So if we can coordinate going back to teaching financial literacy, I think that it was for the people coming out, in a certain time frame. And I will share this one story with you because it stayed with me. In 2018, when we were in session. After session, a gentleman leans over in City Hall and says to me, "Councilman Dom." I said, "Yes." He goes, "I just came down to City Hall to thank you. I took the financial literacy course, and it was a big plus for me." And that like was amazing to me that he would take the time to come and say that. But it also showed me that I think it's so important. So whatever I can do to be of help in that area, I'm available to help you. Just let me know what we need to do. Okay.
Thank you. I'll reach out to you.
Sure. The one last question on, and I'm not clear on this, so maybe you could explain it to me. The people that are up on State Road right now, when they want to make a phone call, is every phone call charged, or is there a certain amount of calls that are free, and after a certain level they're charged? How does that work?
So we increased during the pandemic, Councilman Dom, 15 minutes free minutes, 15 free minutes for phone analog calls. And
Is that
then
per day or how?
that's per day, 15 free minutes per day. For the virtual tablet, virtual visits, they get 10 minutes per day free. And then anything above that, if the family members decide they want to purchase above that, they're able to do so. But we're proud of that offering that additional free minutes for the analog and the virtual where it didn't exist. We stood it up and we're offering 10 minutes per day. Also, I want to acknowledge what you did pre-pandemic when you gave us that generous donation, which allowed us to give and split that funding across and to ensure additional free minutes for all incarcerated persons for that given time period.
Thank you. Let me ask a question, Commissioner, and I'm no expert here, so I'm asking your opinion. It seems to me, God forbid, if I was there, I'd want to speak to my family more than 15 minutes a day. I want to speak to my spouse or my children or my parents more than 15 minutes a day. And it also might help me rehabilitate because I'd have more motivation to get back to my family. Is there any way we can increase that to give them more opportunity, more time with their loved ones?
We're looking at doing that now. We're in the process of expanding and adding tablets for that purpose. But we're looking at the cost to see how we can increase, and we will reassess that and get back to you on that. But that's some of the work that we've been doing, is to try to reduce the burden on family and friends who have to purchase and increase the free phone time. But I will get back to you.
I think it helps rehabilitate people to connect with their families and hopefully prevents them from coming back. Yes. And you don't have that recidivism rate yet, do you?
DC Bagby, I'm not sure if he's...
Yes. Good afternoon,
okay.
Terrell Bagby, Deputy Commissioner. Looking at the performance measurements for 2021, the first year rate was 29% recidivism rate, and at the third year, it was 53%. And also, Commissioner, I would add that we did a tax preparation initiative with a campaign for working families, where we had 444 incarcerated individuals file their taxes, and the average tax return was $1,800. And we have close to 200 that we just have to do additional follow-ups on. Our work with Campaign for Working Families is being recognized at the Code for America Summit, and we have a panel called Scaling Up Tax Preparation for Incarcerated Individuals next week.
That's great. That's great. Let me just make sure I understand what you mentioned. After 3 years, the return rate to the prisons is 53%?
Yes.
Yes, according to our performance measurements. Yes, sir.
What is the recidivism rate on the New Leash on Life program with the dogs, which I think I've been there, I've seen that. It's a great program.
What I can tell you is that they have historically been far less than the PDP's general population. They're about 6% or less.
So I guess the challenge here is, how do we really dramatically lower that rate?
I think how we're going to dramatically lower that rate is that we are now pivoting to more certification programs, that when people get out, that they're connected with a support system in sustainable jobs, and ensuring and supporting that they comply with whatever release orders. But I think that is the way to go.
Okay, thank you. I know my time's up, but thank you very much, Commissioner. Thank you to your staff, and appreciate all you're doing. Thank you.
Thank you, Councilman.
Thank you, Council President.
Thank you, Councilman. The question that Councilman asked, so it was 29%, and now it's 53%?
So we capture recidivism by the first year, third year, and fifth year.
Okay. What's we have a sense of what's going on with that?
Well, what we can
Number.
say, when we talk about recidivism, it's not one answer. It's the totality of that person's engagement and interaction, whether it be financial, housing, health, sustainability. I mean, people are coming back if they don't have jobs, which we're in a very good position. And if we can remove any barriers from people to get into these jobs. So we're open to partnering with employers who can establish that relationship pre-release. We work with folks, they go out. It's sustainability, really. We've operated for a long time on these 3, 9, 6 month opportunities. The individual gets used to having that level of income, but it's simply not sustainable. And once it's over, people go back into survival mode. They have to provide for themselves, their families, pay rent, get housing, the same thing we do. And so that's where we have to do more of this sustainable placement and job opportunities.
All right. Okay. I'll come back. I'll ask you because I want to ask you about your connection with the organizations. I know a lot of those individuals travel to the correctional facilities all the time. I want to see if there's some formalized way of formalizing that relationship, since they have their charge is to basically be the liaison between the city and the individuals that have challenges, to kind of get people focused, because we got to bring that number down. Okay, sorry. Chair recognizes Councilwoman Brooks.
Thank you, Council President.
You're welcome.
Hi, Commissioner. My question is kind of a follow-up from Councilmember Jones and Councilmember Thomas's question. And the question is what type of investigation was conducted in response to each jail death since the start of the pandemic, and what changes have been implemented in response to the findings of these investigations?
So what we do with all investigations, we assess and take a look to see what are the circumstances, were policies and procedures followed. We also cooperate and work with law enforcement to share any additional information. We do, it's a lot of intensive investigative work. We're not able to give all of that information in this platform, but that's what we look for. And we review were the policies and procedures followed as part of our investigation. And we cite and address if any are not followed and take the appropriate action. It is a process. We have a Office of Professional Compliance who works with our criminal justice partners, and they follow the case start to finish. And so if it comes up that we determine in instances where staff did not adhere to policies and procedures in the performance of their duties, we take the appropriate action with those individuals. But in this form, I wouldn't be able to list all of the steps that we take. We act on tips, intel, surveillance, and then interviews.
Okay. All right. That's helpful. My next question is about the Remnick lawsuit, and multiple prison society reports have indicated that a vast majority of people haven't been getting out of their cell. The time they haven't been able to get out of the cell in the times that they have the right to. What changes have been made to ensure that each person is receiving their out of cell time? And can you confirm that they have been getting out of their cell?
Yes,
getting their out of cell time?
Yes, I can confirm we have been doing over these last 6 months, we've increased out of cell time. As part of the litigation, we do report to the federal courts. That information is reported to the federal courts. And if we are not in compliance, we would be receiving a response. So they are getting out of cell time above 3 hours. In segregation or special management, it is 1 hour. In those incidents where if we're short of staff and not able to do it safely, we provide that response to the courts. So we are being monitored by the courts. So even though individuals are reporting to PA Prison Society, we also provide a weekly report through our council that goes to to the judge overseeing this matter.
Does it also go to the prison society as well, or it just goes to the judges?
It just goes to the judge. That is the governing body. Certainly, we've allowed the PA Prison Society to come in, have unfettered access and interaction with the population. They can share that information with her, but we report directly to the federal judge.
Okay. There has been lots of talk about staffing and acknowledgement of staff shortages, but we've also seen that the prison department say that multiple times that reports of understaffed and unsafe units aren't true. Do you dispute the prison society's report about unstaffed units, as well as the many reports that there are no COs available in some parts of the jail for emergencies? And what is your opinion on how the staffing shortage is impacting the safety of people being held in jails?
Well, the staffing shortage, what we've been trying to do is encourage all of our workforce who are still employed with the city of Philadelphia to report. It is important that everyone who is employed reports so they can support the staff who are physically in the institutions. In the cases where there are just no staff or a small number we're impacted, we have staff touring both units. And that is nationwide. This is not unique to Philadelphia. And I always, when I'm interacting with the prison society and was sharing information, keeping it in the context, we're not isolated. We're not that special case. We're faring better or not so good when we're compared to other jurisdictions. But we do have individuals who can routinely tour that area if we are short, but it's not that one person, just no one there. Someone will go on and tour the area. Yes, that is correct. But to the levels that we're hearing from PA Prison Society, I disagree.
So you're not disputing that there are times there aren't people on units. You're saying that they could be just overseeing or touring other parts of the prison at the time, but
It's not. Oh, I'm sorry. Go ahead. It's not a touring other. It's in the immediate area. It's dependent upon the design of the facility. So you're not having someone at the lobby go in and tour area. There are staff in those immediate areas. And it's not multiple units where you're saying, okay, no one's there. So we've asked information from PA Prison Society, provide specifics to us so we could have a robust investigation, take a look at it. And we can check that against the information that we have.
Just for my own clarity, since Councilmember Jones have taken me to several prisons, at least I have a idea. I just want to make sure my visual is okay. Are you saying that some of the facilities that we visited, they have like a station and then they have various pods? Are you saying there could be someone in the station, there just isn't someone on the pods?
No, that's not what I'm saying. There's someone on the station, someone in the pods. So if there's one unit where there is no person assigned, we will have someone go around and tour. So it's not just that one individual sitting in the pod watching 4 units, which is not the case.
Okay. Thank you. Thank you for that clarity. And thank you, Councilmember Jones. That was very helpful for me to kind of break down a visual. My next question is, given the chronic mental illness issues and drug addiction and other issues that the community faces, how much money has been spent over the last 2 years on programming based on cutting edge research for rehabilitative programs for the many people that are suffering from mental health issues in jail? And what recent data driven models have the jails been looking at around the country to introduce in Philadelphia?
So the information and the programs that we had pre-pandemic, we plan to stand those up. We had a contractor, behavioral health contractor, who had an excellent model, but they are no longer with us. So therefore, we are no longer able to utilize the proprietary behavioral health program. We still provide behavioral health counseling and services to the population. Our MAT, which is our medication assisted treatment program, is still underway throughout the COVID process, but we're in the process of, with our new vendor, looking at a behavioral health program that is utilized in other jurisdictions under their contract and bringing it here to Philadelphia.
Do you have the name of that program?
That I will get you the name. I can get back to you on that.
Thank you so much,
Dr.
Commissioner.
Herdman, thank you. Dr. Herdman, did you have the name of the program by chance? It escapes my memory.
This is Bruce Herdman, Chief of Medical Operations. I don't have the name at the moment. We're still listed in the SAMHSA, the Substance Abuse and Mental Health Services Administration Guide to Substance Abuse Treatment, as one of the 6 best practices in the country. We're spending probably about $3 million on medication-assisted treatment. That's one specific part. There's about $15 million of behavioral health staff that provide services across all of the facilities, and those are all services that are endorsed by the National Commission for Correctional Health Care, which is the accrediting body that's equivalent to like the Joint Commission for acute care hospitals.
Are all those services fully staffed?
We have our vacancy rate on the medical side, which was 22% at the highest, the worst part of the pandemic, is now around 11%. So we do have a backlog in some areas, which we're working to catch up on.
And I would like to add, if I can, the prison was also affected the same way that hospitals were in recruiting and retaining behavioral health and medical staff. And so we're in that same boat where we're pulling from agency staff to come in and fill those vacancies. As Dr. Herdman stated, we have a backlog. It's we constantly chisel away at that, but there are staff here. And with hospitals, universities, clinics, they too, we're pulling from the same pool of folks, but we're doing all that we can to fill those vacancies.
Thank you so much. Council President, that ends my questions.
Thank you. Thank you, Council Lady. Councilwoman Gauthier is back.
Thank you, Council President. Good afternoon, Commissioner Carney.
Good afternoon.
Before I start with my questions, I wanted to make a few brief comments. First, I want to acknowledge the very hard job that you have, which I don't envy at all. But I also think that as a city, we have to acknowledge that at this point, there is a crisis going on in the prisons. I don't believe that enough has been done to either acknowledge that or to address it. Since the start of the pandemic, it's been reported that 29 people have died in our prisons. And though I understand that some of these conditions are being experienced in many parts of the country, it was also reported that in 2021, our death rate in Philadelphia prisons was 77% higher than the national average. And many of these deaths are a result of the dangerous conditions created by staff shortages that have been acknowledged throughout this hearing. And I greatly appreciate the efforts of Councilmember Jones and Gim and Brooks in pushing on, this issue. They've by far been council's champions on this. But I also think that we haven't quite gotten there yet in engaging in more honest conversations with the administration to determine how our city is going to resolve these issues and how we're going to do it quickly. And so with that being said, I'm interested in talking about oversight, and in particular, the role of the Prison Advisory Board and their ability to provide any policy guidance or oversight on how to address these ongoing safety concerns. Is there anyone here from the Prison Advisory Board today? Hello? Can you hear me?
Commissioner?
I can hear you. I don't believe anyone from the advisory board, they wouldn't be able to make a presentation during my presentation as part of the protocol. What I can say is, as a city, it's been very challenging operating the Department of Prisons. We're part of the city. We're one of the major departments, right? But there have been just public comment by elected officials about all things bad. And so words matter. Words have power. And so if elected officials are saying these things, I think there's a way and a path that you can do it. But it's kind of like we're the disconnect of the departments. But the homicide burst, the 5 deaths that occurred over the 7-month period at the height of the COVID pandemic. And I'm happy to say that none are occurring over this year. We're almost midway.
I do have more questions.
I just wanted to respond. Also, regarding completed suicides and deaths, following, of course, the advice of our forensic psychiatric consultants, we compare the 3-year average to national data. Our 3-year average remains well below the national data. And we also review every case, serious attempts, and we work and have that evaluated by our consultants. One of the things that we are meeting and have met over these 6 years with our advisory board is we share this information. We encourage them to come to tour, but I ask them also and encourage them, don't take what I say, look at what's happening nationally and let us come from that framework. I think there's a way we can all work together, but I think as a city, our messaging will go far more, and be impactful if we're saying, hey, listen, there's an issue. We've been transparent. We're sharing information. When we share that information, however, it's not translating to the public. We're sharing this information. I mean, correct me if I'm wrong. We're sharing this. But when it comes out, it's just, this is what's happening. This is what's happening. We know this is happening around the country. But I think as a city, one of our major departments, we need to work together to get better messaging out together.
Thank you. I can appreciate how hard the job must be, how hard it must be to, to be in this public space, right, with all of the things that have gone on. But I still feel like we have to have a crisis plan to meet a crisis. And I feel like we have to be honest about what's happening. And so my questions are about the advisory board. I would like to know what the role of the board is and whether they've conducted any investigations on the conditions of our prisons, including but not limited to our facilities and our staffing policies.
So the board is advisory in nature. They can provide advice regarding policies and procedures. I encourage them to reach out to nationally known and recognized in resources, such as MacArthur, such as the Vera Institute. I know I encourage them to do that routinely throughout this process. They have reached out, so I believe they will be providing you some information. In regards to touring the facilities, it is open and available for them to do so. And I believe they had 2 tours during the pandemic.
Has the advisory board offered any recommendations around facilities and staffing and other things that have been occurring in the prisons during the pandemic?
We reported out there weren't that many significant recommendations. We're sharing information. I did inform them that we're in negotiations with our labor contracts, and I informed them of that, but we haven't received a large litany of recommendations, but they can provide information to advise. What I've been encouraging them to do is to look at our length of stay, see how we can reduce the population to further decrease that pretrial population. Right now, we're at 93% pretrial, and the remaining being sentenced. It should be reversed because county corrections is designed for short-term stays. And so those are the things that we were pressing upon to see if they could come up with any of those recommendations.
Okay. Does the board have the ability to audit any investigations conducted by the city of Philadelphia on the prisons?
No, they do not.
Okay. Thank you so much. Thank you, Council President.
There you go. Thank you. Thank you, Councilwoman. Chair recognizes Councilman Jones.
Thank you so very much again, Mr. President. I guess what I would want to pursue at this point is some of the contraband. You mentioned a contraband detector. One of the things at our visit up there was the distinct smell of burning K2 and other products that can be put in cigarettes and stuff like that. And literally, I gotta tell you, I don't know about my other colleagues, I was getting a contact. I don't know what K2 feels like, but it felt like something. And your members of the corrections professionals are exposed to that. How are we addressing that? They shared with me that sometimes it comes through on paper in a letter that they scrape off. They talk about other ways that it got in. How do we get a control over that? Because it's got to be hampering any true rehabilitation effort.
Thank you. Fair question. So during the pandemic, we had suspended visits for a majority of the time just to, mitigate the spread inside our facilities. And for quantities that come in through the mail, we too, again, this is a small niche that you don't have a large number of variety vendors to choose from. And so we submitted for a mail detection contraband scanner. I'm pleased to say we finally are very close to receiving that, and I expect to receive that in June. We will begin processing our mail through that new mail scanning technology. We haven't hit the needle on contracting out the mail processing just yet because I'm following with my hand on the pulse. There's litigation arising out of that regarding the quality. So I'm reserving it. It's not off the table, but I'm watching. So we anticipate having the mail scanner come in. But what we've encouraged,
just as a point of information, there might be litigation if you prevent people's mail from coming through. Is that what
yes,
you mean, Commissioner?
yes.
Okay.
So there's that's the other side of this now. We know other jurisdictions have done full throttle. There's some issue about the quality, and so I'm monitoring that. What we had from the very beginning, anytime there's an odor in the air, there's an air exchange process. The impacted employee should notify the supervisor immediately, and we activate that system to clear the air and circulate fresh air in, dirty air out. We believe this will give us the capability to detect what's coming in the mail. Now, those larger quantities, which there's no way they could come in through the mail, but they are being introduced inside our facilities. We just received the approval to utilize our body scanner. That body scanner, and we're in the process of finalizing our implementation schedule. This will give us the ability, similar to when you go to the airport for a flight. You go in, we'll be able to see contraband, whether hard or soft, concealed in the body cavity, under the breast area, genitalia, and buttocks, or inside the cavity. We'll be able to see that, bring that individual out, put them in the appropriate location so they're not able to introduce that information in. We have seen an increase in contraband, and this is going to be coupled, this new technology mail body scanner, with our canine and our diligent searches of our correctional staff. They have been on point. We have we act on information, anonymous tips, and intel. We search the areas and we do all we can to retrieve that. But we want to stay in the other population who's not participating to be safe.
Got it. My last point, I heard the bell, is to what degree do we still utilize the trailers for weekend sentencing due to like DUIs and other, what is the category and how big is that population in the trailers?
Thank you for that, Councilman Jones. We discontinued that at the start of the pandemic. The reason being, we're a large carceral setting. We're the largest hospital in Philadelphia, keeping on average 45 individuals in these facilities. We had to mitigate our spread and our community spread. We have remained lower than the community spread as far as COVID, right? So when we talk about DUIs, when we talk about the other programs that we used to utilize those trailers for, the risk outweighed the benefit. Because if you have one individual in, just it takes one day and one positive person, and now you infect a multitude of folks. So we haven't resumed that just yet. We still are encouraging our population to take advantage of the vaccine, and we will reassess that. But as the community spread is going up to 41%, even though hospitalizations and deaths are not going up, I can't afford to have now the work that we're doing. That would bring me back to the strictest lockdown. People aren't able to go to virtual visits, programs that we activated. So that's a case by case, and I'm assessing it to see once I see that community spread at 41% and we're below 5%, it's not worth the risk. But I
Thank
will.
you.
It's on my radar.
Yeah, I was wondering the alternative. Some people need treatment, and that DUI piece allowed weekend service of sentence to not disrupt jobs and things like that. So, but thank you for that, Commissioner. Thank you, Mr. President.
Okay, good. Thank you, Councilman. There does not appear to be any other members in queue. Any other questions by members of the committee for this witness? There being none, I want to thank you all very much. Commissioner, thank you, you and your team for doing a very difficult job in very difficult times. We really appreciate all the work you've done and your forward-thinking approach to reform, and also ensuring that the citizens of the city of Philadelphia feel good about what you're doing. We appreciate it. Thank you all. There being no additional questions, this committee will stand in recess until Tuesday, May 24th at 10 a.m., at which time we will reconvene on Microsoft's team. For the record, there will be a number of callbacks per the request of council members. So we will send you out the list of all of the callbacks so you can be prepared, and hopefully tell them to actually be prepared to respond to any questions that happen during the course of their traditional budget hearing. Thank you all very much. Appreciate you. Be safe, please.
Thank you, Prez.
You're welcome.